Hello, and welcome to a brief online tutorial on how to create bivariate or 2x2 data tables within the AskCHIS web tool. Creating bivariate data tables is a very sensitive and intricate process, not because the data tool is difficult, but because the interpretation is especially valuable. And so we want to make sure to walk you through that process and show you how to create those data tables and then read and understand the interpretation effectively. In order to get started, you'll need to navigate to ask.chis.ucla.edu and log in. Once you log in, you'll have to select a geographic area to start your data search. In most cases, you'll either have data preloaded from data searches that you've done previously, or your geographic area will already be defaulted to the state of California. If you're new to the AskCHIS web tool, the default is always the state of California. In this case, let's go ahead and select Los Angeles County. However, keep in mind that you can select different regions and counties, as well as service plan areas and San Diego County health regions if you wish to do so. Once I've selected my location, I'm going to go ahead and click Next. And now here I can select my topic. For my first topic, I'm interested in looking at access and utilization. So I can either click the access and utilization category, or I can do a keyword search under the search bar. For today's purposes, I'll go ahead and use this categorical function because it makes it very easy to choose from a high-level category and then drill down to more specific categories underneath that main category. For today's purposes, I'm going to go ahead and look at those who have a usual place to go when they're sick or need health advice. And this is called usual source of care. You'll notice that once I've selected it with the radio button clicked, it tells me the data, the years the data is available, as well as the age ranges included in the data set and how the data variable is constructed. So in this case, this wasn't a simple question. This was multiple questions that came together into a constructed data variable. So as I scroll up, I now have the option to select a compare topic. So I'll go ahead and select Next and choose a compare topic. A compare topic is a secondary topic. You can also do a keyword search or select this topic from a category. Also, common comparisons is an option where we go ahead and let you know what we think you might be interested in seeing based on what most people look at when they run data within the system. So under select a category, I am actually interested in health insurance, so I'm going to go ahead and click health insurance and current coverage. Instead of looking at currently insured, which was one of the suggestions, which only tells me currently insured versus not currently insured, I think I'm going to go ahead and look at type of current health insurance coverage. And the reason I do this is because when you look at currently insured, that currently insured yes category includes public insurance. So it includes our Medicares, our Medicaids, right? And all those public programs, which are wonderful, but it does paint a different picture. And so we want to look across different groups and different experiences. Now that I've gone ahead and selected this group, I'm going to go ahead and click Next. Now I have the option to limit my population. In this case, I'm not going to limit my population because the data variable I selected already limits it to under 65 years old. But if I wanted to, I could limit by age, I could limit by gender, race, or federal poverty level. I can also change the years. The year will always default to the most recent data year, which is 2015. But if I wanted to view older data, I could. And if I wanted to pool multiple data years together, in the case of maybe a small geographic area or small racial ethnic group with a very low population, I could do that. And pooling those data years together gives me more statistical power, makes those results more stable in those cases. For today's purposes, I'll go ahead and go with the single most recent year of data, and all I need to do is click Get Data, and that data table will populate for me below. This is a simple 2x2 data table. We have our usual source of care on this side, along with our type of current health insurance coverage at the top. And the way we would read an estimate from this data table is fairly simple. So under uninsured, you'll see 43% here. And the way I would read this is that according to estimates from the 2015 California Health Interview Survey, 43% of those who are uninsured do not have a usual place to go when sick or in need of health advice. And that's a pretty dangerous thing when you think about it. The other option is that we can go ahead and switch the data table up a little bit if we want. So in this case, you'll notice that the numbers we're reading are a percentage of the insurance category, and whether or not within that insurance category someone has or does not have a usual source of care. We do have an available option under Adjust Layout that is called Transpose Topics. When I select that option, it flips my main topic with my compare topic, and it changes the data display. This is not like transpose cells in Excel, which just switches your rows with your columns. Rather, in this case, we're actually changing what the denominator is and how the data is read. So for example, this time, if I want to look under uninsured, I would read that 30.2% of those who do not have a usual source of care are uninsured, compared to 34.1% of those who do not have a usual source of care that are actually on Medicaid, or Medi-Cal as we call it in the state of California. So it's a different data view, you'll notice, and the percentage, this 100% doesn't make up a certain insurance category, rather it makes up who does not have a usual source of care. This can be really helpful when program planning. Maybe I want to know, I have to reach this group without a usual source of care. Who are they? So both options are available. So I'm going to go ahead and switch my topics back by clicking Transpose Topics, and the original data table I was looking at earlier will populate. We also have another interesting option. Under Compare Geography, we can compare the geography that we're looking at to the state of California as a whole. And I really love this option because it allows us to see if the data that we're looking at for our region is really impactful or not. For example, we know that 43% of those living in Los Angeles County who are uninsured don't have a usual source of care. That's our estimate. And if you look at the entire state, that trend is underscored. 42.4% of the uninsured in the state also are reporting, that's our estimate, do not have a usual source of care. So you'll notice that a lot of these numbers are very close across counties and across the state, representing a similar experience in this case. Thank you for taking a moment to hear about bivariate data tables within the AskCHIS web tool. I appreciate your listening in, and I hope that you find this tutorial very helpful. Please don't forget to listen into our other tutorials if you're interested to learn about how to create data displays or how to export data from our web tool. Thank you and have a lovely day.